So the third concept is electronic patient encounters. If you have an instrument that may be able to perform or collect findings that are equivalent or substantially equivalent to a slit lamp biomicroscope, and also perform a full suite of functional and structural tests using or simulating the same results as all the machines in our current eye clinics, that's a very comprehensive evaluation. This is something that a patient could do on their own and send to the doctor, but imagine if these instruments were used in a clinical setting first. The patient walks into a clinic, and instead of being greeted by a check-in person and then a technician and a series of tests, they simply sit down at a pair of binoculars and swipe a smart card that you gave them at their previous visit that ordered all the tests that you want them to have that day, such as visual acuity, extraocular motility, pupillometry, and retinal OCT, for instance. That data can be sent to the doctor in the clinic room before the patient even enters the room. And when the patient enters the room, the doctor can spend a lot more time now making a diagnosis, demonstrating the findings to the patient, and implementing treatments, and hopefully perform a better exam because of the quantitative methods used in a shorter period of time, so they can see more patients in a given day. Imagine that same process could be used remotely instead of in a clinic. So a patient who goes to a local pharmacy or supermarket or even has a pair of binoculars at home can perform this self-examination with all the tests that were pre-ordered by their doctor. The data could be sent via the internet to the physician, who can evaluate the patient completely and tell them whether they need to come in and see them, whether they are okay and can come back in 3 months. So remote evaluations may be very useful in places where people can't access care. It saves patients money and the time of having to travel and lose work time, and may be much more efficient for doctors as well, because they don't have to pay clinic staff to run a busy clinic, and may be able to see patients even faster when it's an electronic examination, and therefore see more patients in a day. The holy grail for this is automated assessments for the purpose of comprehensive eye disease screening. So imagine an instrument that's actually outfitted with advanced software to enable it to make some of its own decisions, not diagnoses, but risk assessments. This is operated by a patient hundreds of miles away from a eye clinic. And the instrument says immediately you've got a problem or you don't have a problem, and can send those results to a doctor. I think a comprehensive eye disease screening system is far preferable to a non-madretic camera that simply looks at the retina and maybe the optic nerve, or other screening tests that look at one aspect of eye disease. This instrument can evaluate many, or in fact most, aspects of eye disease, and a self-operated instrument like this may hold the key to comprehensive eye disease screening, so no stone is left unturned, and comorbidities for retinal diseases or glaucoma are not overlooked. This requires advanced software that is not yet available, but we expect to be available in the next year or two, and hopefully will come to pass so that we can use this for screening. So just to summarize electronic patient encounters, we hope that the self-administered aspects of this device will take the burden of collection of clinical findings off of the physician and put them more on a patient in a very simple, convenient environment. So our training in medicine really prepares us to make diagnoses and implement treatments. That's what we're really good at, because that's what takes so much thought. Collecting findings really doesn't take as much thought or expertise as the latter two. And if you knew this instrument collected findings as well or better than you might, because it does it the same way every time, it's quantitative, it's objective, it's consistent, it's documented, you might be able to spend more time making diagnoses and treatments. Hopefully that will standardize the delivery of care, whether you are in the United States or in China, and improve the quality of care, because it's now providing quantitative data, quantitative pupillometry, quantitative extraocular motility, quantitative strabismus evaluations. These are things that currently aren't done or are hard to do. Remote examinations have the potential to make patients much happier, because they don't have to lose time, work, and money and sit in a waiting room with dilated pupils to see a doctor, and also improve the happiness of physicians, who may be able to increase the number of patients they see, and customize follow-up intervals for complex diseases. As an example, patients undergoing injections of anti-VEGF therapy for retinal disease often come back on a programmed schedule of every 4 to 6 weeks. Instead, if those patients use this instrument and scan themselves every week, the doctor could say, you know what, why don't you return to see me when your cystoid macular edema comes back, or when your subretinal fluid comes back. And if that happens at 3 weeks, they come to see you. If it happens at 7 or 8 weeks, they come to see you then, instead of this pre-programmed schedule. Hopefully that will decrease expenditures for these very costly drugs, and also it makes room in clinic for people who really need you on that day. Seeing a lot of patients for routine follow-ups when there are many more patients waiting outside the door with urgent problems is certainly an issue for many clinics. And it'd be better to save those key in-person office slots for people who need treatment on that day acutely. And as I mentioned, automated assessments, a comprehensive screening solution, I believe, is the holy grail for an instrument like this, and could reduce the need for in-person clinic visits if this instrument could make assessments on patients automatically and say, you know, you're safe for another 6 months or another year. You don't have to go see your eye doctor. That would really reduce the burden on eye clinics.